Hey everybody, Tim White, clinical specialist here with the Aspen After Surgery Center. We are here with our patient today who's graduating. Congratulations, you did awesome.
Thank you.
My pleasure. This is what we love and this is what we see with our patients that make us just extremely grateful to have such great patients like you who did so well and compliant with the program. So we're going to protect our identity a little bit here by setting up the shot the way we are. But the short and sweet is graduating today. You got great results. Your breasts look great. They're soft. Before coming in, you had both of your breasts encapsulated and firm, correct?
Correct.
Okay. And a little bit of history is that she had had 2 previous surgeries, both of which resulted in an encapsulation, correct?
1 previous surgery that resulted in encapsulation.
So your first surgery you had contracture, you had the surgery to correct that, and you got contracture again.
Correct.
Okay, so 2 surgeries resulted in 2 encapsulations. With your last surgery, you had the skin strip put in, what they call ADMs or meshes or other types of things, which despite having that as a means to help prevent contracture, you encapsulated anyway.
Exactly.
Okay, so you did great.
I did. I'm so happy. I can't even tell you.
Awesome. If you had to tell women out there right now who have encapsulation, they're considering surgery versus non-surgery, what kind of info or feedback could you give them?
100% try this first. First of all, it's a lot cheaper than surgery. It's easier on your body, less scar tissue. And I came in here totally skeptical. I honestly did not believe it would work, but my doctor had said that it would be crazy to try a 3rd surgery. So I did this as like a last resort. I cannot even believe. I wished I had done this before I had my 2nd surgery, because you all probably could have corrected it without surgery.
Yes. We have 2 options that we give to patients. You can have an existing capsule and a problem, and we can treat that so that you don't need to have surgery. But if for some reason a woman does require surgery, we can use this as a prevention backup, which we do exactly 2 weeks after surgery. So in case somebody has to have the implant replaced, if the implant is old, if there's any reason that we just can't treat you, we have a prevention treatment that we do exactly 2 weeks after surgery, in which we don't wait. So in your case,
I would have done it.
Yeah.
If I'd known about it, 100% I would have done it.
Yeah, and that's why we shoot these videos, to let women out there know we offer an out-of-town fast track. So patients who live in other countries and states, you can fly in for our 1-week fast track, fly in 1 weekend, fly out the next weekend. In your case, you're semi-local, so you chose to drive to us. If you had to give your overall improvement of where you were to where you are now, if you had to give it a 0 to 100% better scale for both breasts, what would you give it?
100%.
100% improvement, meaning your softness and the way the breast looks, you would grade that as 100%.
100%.
Very good.
And I think what people would want to know, at least what I would want to know, is there was a visible difference after the very first treatment.
Mm-hmm.
So, and you gave that kind of as, just try one and see what happens. And I left here going, I called my doctor, I said, it's going to work. Like, this thing's amazing.
Right. And, Beverly, you were sitting in the waiting room with another one of our patients who's actually a first-time patient. You actually gave her feedback. She had that same concern. I just met her for her initial evaluation now. She couldn't thank you enough for that feedback, and we told her the same thing. Patients will see an immediate improvement, meaning the very first session on the first day, you will see an improvement. I'm about to actually walk back into her room after her session now, so we can get her grade on how well she did. But yes, this is something that we see. Improvement, first session, first time, that helps us grade if you're a candidate or not, and if you are, we continue on with that. Mm-hmm. Awesome. What else would you let any women out there know who are thinking about it? Should I do surgery? Should I do the Aspen treatment? Any other pearls or gems that you can maybe give them?
Well, I think the other thing for me is the knowledge that there's such a rare chance that I'll get encapsulation now. Because that was always hanging over my head after the 2nd surgery, thinking, what if I keep doing this?
Right.
So the thought that you guys, now I believe you because now I've seen it. Mm-hmm. I know what I need to do for the rest of my life, and that's such a simple thing that I don't have to massage every day. I don't have to do all of that.
Right.
So again, I don't know any reason why somebody would not do this instead of opening themselves up to surgery and anesthesia and more scars.
Right.
I really don't know why anybody wouldn't do this.
Yes. We always suggest do everything conservative and non-surgical first, then in the end, God forbid, you are not a candidate, then we can discuss surgery and go from there. So yeah,
Exactly.
good advice. Awesome. Well, anybody who wants information, hit us up on the banner below. We have the website, we have the phone number. Make sure that you like us on all the social media, and please subscribe to our YouTube page.